name is April. I'm going to be doing a diabetic foot exam. This patient, for the purposes of this video, she's not a diabetic, but we're going to pretend that she is. So with your diabetic patient, you want to make sure that you check the feet. You want to look for any digital deformities of the toes. Make sure that there's no hammer toes or curved toes. If you do, you want to watch and make sure that they don't have any breakdown or calluses that could be rubbing on the bottom of the shoes or on the tops if they have the curvation there. You want to check for equinus, which is tightness of the heel cord. So make sure your patient can dorsiflex past 90 degrees. If you have tightness in the heel cord, you could put additional pressure on the bottom of the foot, especially on the metatarsal heads, which can make callus formation and breakdown. You also want to check for amputations. You want to check and make sure that the patient's not had a previous amputation. If they have, that could indicate them at further risk for further breakdown and amputations in the future. On your skin assessment, you want to check, you want to look for things such as athlete's foot. You want to check for any fungal growth around the toenails. You want to make sure that you check between each toe. And you want to check for any dryness or any calluses. If you have a callus formation or cracks, that could lead to a serious ulceration. You want to make sure that there's no gangrene. And we talked about the thickening toenails. You also want to make sure the toenails are cut straight across, and hers appear to be. And if not, they can have an ingrown toenail, which could have reddened or hardened calluses there on the sides. You also want to check the temperature of the skin. Check both on the top and the bottom. Anything too warm can indicate a fever, which could lead to infection, or anything too cool could indicate a circulation deficit. You also want to check for hair loss or any venous abnormalities. Any patches of hair loss could indicate poor circulation. And if you have a patient that has this, you might want to consider tests such as the ankle brachial index. You also want to look for swelling, and she doesn't have any swelling. Check for cap refills, so when you blanch the skin, it should return to normal within 3 seconds. So then we're going to move on to the sensation. You want to check and make sure that the patient has good sensation, otherwise it could lead to peripheral neuropathies in the feet. So the first one we're going to check is with the monofilament. This is just going to press until you feel the patient on the tip there. You'll have the patient close their eyes. And we're going to check at the top and ask them if they feel it.
I feel it. I feel it.
I'm going to do that along each toe and in separate places on the foot. When you do this, you want to make sure that each time you do your exam yearly, that you do that in the same spots and you document that. You also want to make sure that they have a vibratory sense. If they have a decreased vibratory sense, that could indicate a progressive neuropathy. So the patient should stop feeling it at the same time that I do.
I don't feel it.
Okay. You also want to check for sharp and dull sensation. Have the patient close their eyes again and do the soft tip and then the dull tip for sensation. And make sure you do that on the top and the bottom.
Soft. Dull. Dull. Soft. Dull. Soft.
Okay. And you also want to check the pulses and make sure that you have equal pulses bilaterally. Check the one on the top, the dorsalis pedis. And I like to make sure that the patient's equal in both feet. And then check the posterior tibial, which is just posterior to the ankle. And hers are good on both sides. You also want to check the reflexes. Make sure that they don't have diminished reflexes. If they do, that could also indicate poor circulation or neuropathy. As far as education, you want to educate your patient that they should examine their feet every day prior to putting their shoes on. Make sure that they wash their feet well every day, dry them very nicely. In between each toe, you don't want any moisture remaining. And they should have a yearly exam by a physician or a healthcare provider, a nurse practitioner. And if they have any calluses, you want to make sure that they don't take care of those themselves. They will probably need a referral to a podiatrist. They should also make sure that they check their shoes for a good fit. You want to have not too loose, not too tight. You don't want anything in the shoe. They should check the inside of their shoe daily to make sure that they don't have any rocks or any debris that could cause ulcerations or pressure. Also make sure, just in general, that the patient is keeping a good control over their blood glucose. Their hemoglobin A1C should be around 7. Also, just in general, check about their blood pressure and make sure that they're just taking general good care of themselves. And that is how you do a diabetic foot exam.